Hey, Miss Edelman, what's going on? It's Sam again, back for another video over intramuscular injections. So, we're gonna start off making sure we got our hands washed when we go in, wash in, like you always tell us, and make sure we got our proper PPE and put our gloves on. After we've done that, we're gonna make sure that we got a doctor's order to administer this medication. We're also gonna gather our appropriate materials. So, I got my patient, old Mr. Orange over here. We're gonna make sure that we got our medication. So this vial right here. Make sure that's all at a sterile site as well. And for IM injections, normally you use a 1 mil to 3 mil syringe if the desired dose is greater than 3 mils. Greater than 5 mils. Then you would calculate the dosages and give them at separate times throughout the day. But for this case, that's not the case right now. So we've got a 3 mil syringe, and normally you're going to use a 25 gauge needle. So we've got our needle ready to draw up his medication. And after we've evaluated our medications and everything, made sure everything is where it's supposed to be, we're going to uncap the vial. If it's not, it's already uncapped, but we're gonna act like it's not, so we're gonna uncap it. Clean it with a alcohol wipe, and then we're going to prepare our syringe. So we want 3 mils, so we're going to draw up 3 mils of air. Just like that. And then when we insert, we're going to go bevel up about 15 degrees at first to break, and then straight down, just like you told us to. Ooh, I'm running low on medication. Put it all in my orange. Now, flip it upside down, push it in, hold it, and then begin to draw up our medication. There's 3 mils. So there's 3 mils, put it back down, put our vial down, recap, make sure that we got 3 mils, which we do. Now we're going to choose a proper site on our patient. So for this case, IM injections, you're gonna go ventrogluteal, ventrolateral on the thigh, or you can go at the side of the deltoid muscle on the shoulder. You do not go, or it is not recommended to go to the dorsogluteal side now, because of risk of, for one, it's a vascular area, and also for risk of hitting the sciatic nerve, which would be very painful for a patient, and we don't want to do that. So you're going to avoid doing that. You can also use the rectus femoris side. However, that's only for adults. But we're going to choose the deltoid muscle, so side on the shoulder. If we're doing it on a patient, do it on orange, but act like we're doing it on a patient. So side of the deltoid muscle, expose the site, clean it with an alcohol swab, and after we've done that, we're going to let it dry, and then I'm going to make sure that I've got the right needle right here, and then I'm going, once the site's exposed and dried, it's time to inject. So we're going to go straight at a 90. I'm gonna go 90-degree angle in, nice and smooth. And then you can push the medication with either your index finger or your thumb. I'm gonna go thumb. And you wanna be sure not to go too fast. Inject it nice and easy right there. I got fluid coming out of my orange. Once we've done that, we're going to smoothly remove it. And then here's the cap that I'm moving over here so that you can see me cap it right here, just like that. Dispose of it in the sharps container as soon as possible. Always want to maintain proper safety. You can aspirate on IM injections, so you would just pull back once you've entered the site. If there's no blood draw back, then you just go in as normal. Once we've entered the site and removed our needle, then we blot dry if there's any sign of blood or anything at the site of injection. After that, we certainly want to assess our patient's condition, see how they tolerate the medication, make sure that medication is doing what it's supposed to do, which is to help the patient. And to assess their condition, answer any questions they have. They have the right to know. They also have the right to refuse, but make sure that you ensure their rights for this medication, because they deserve to know. So once all that has been completed, leave them in a comfortable position with the call light on. Ask if there's anything else you can do for them. If not, then your job here is complete and you will go find another task to do. So that's all I got for today. Thanks for watching. Have a good one.